New York City health officials warning a new COVID variant could be more likely to infect people who have been vaccinated. This comes as Washington Post columnist Dr. Leanne Wen admits there's been overcounting of COVID deaths and hospitalizations. Fox News medical contributor and family and emergency medicine doctor, Dr. Jeanette Neshwat, and our friend joins us now. Let's tackle both of those. Let's start with the idea that this new variant is more likely to be had by someone who has the vaccine?
So whether you're vaccinated or not, Pete, it's this Omicron variant. It's called the XBB 1.5. Whether you've had the vaccine, whether you're not vaccinated, whether you have natural immunity, this Omicron variant and any variant can impact anybody. That's just the nature of a virus, and we expect to see more variants emerge. That's what we're used to.
Yeah.
This is now what, our fifth or sixth variant. We've had the original, we've had Omicron, we've had Delta, we've had the UK variant. So this is something that we expect to see. But one thing we do notice is that this new XBB variant, it is more transmissible. But what I'm seeing in my patients, it's not more virulent, meaning it's not more deadly. I don't remember the last time I had to hospitalize a patient for COVID. And that's a sign that we're moving in the right direction as far as natural immunity, vaccine immunity, having the antivirals and the therapeutics. We now know how to manage this virus.
So you can't remember the last time you had to hospitalized, but you do remember the beginning when things were serious. We're now learning, though, as we mentioned in the intro, there was overcounting of deaths and hospitalization. How much overcounting?
Yeah, so it's estimated approximately 50% of the number of COVID deaths and hospitalizations were overcounted.
50% is a huge number.
That's an estimate.
They rationalized locking down and shutting down our lives based on those numbers.
Yeah, and it's so important that we get it right. Why? Because our policies, our protocols are predicated on the data, on what the COVID prevalence is in the community. So if we don't have the accurate data, then we're doing things the wrong way. We're doing lockdowns and shutdowns and mask mandates and vaccine mandates. That shouldn't be done in the first place. But we're setting these protocols.
How does that happen? How does it happen? How do we overcount by 50%? Is it because we said COVID, but it was actually something else?
So that's a great question. For example, say you're in a car accident or you're having surgery or maybe a gunshot wound and you go to the hospital. They're testing and swabbing everyone that enters the hospital. So you may be hospitalized for a car accident and just incidentally, secondarily may have been diagnosed with COVID. That doesn't mean you're hospitalized for COVID. That doesn't mean you've died from COVID. It's just you happen to have a secondary.
That as COVID?
Yes, and that's why we need to make sure we get those numbers right. It's estimated some hospitals, for example, have up to 90% of their hospitalizations are inaccurately calculated to have been COVID hospitalizations. And then as low as 10%.
Was that agenda or was that administrative?
I think it's just lack of organization. I don't think it was intentional, but we know now the truth, and it's important that we, have protocols and regulations based on that.
You've always been great about all this. Doctor, thanks so much.
Thank you, Pete.